There is a study published in the journal Stroke back in 2014 that almost no patient has ever heard of. Yet, it remains one of the most useful pieces of cardiovascular research for adults over 60 to emerge in the last 20 years. The study followed nearly 1,400 patients with an average age of 67. The researchers gave them a single test that took less than a minute to complete, and then imaged their brains. The result was startling. The patients who failed this simple test had significantly more evidence of cerebral small vessel disease, the silent precursor to stroke, than the patients who passed. The test was incredibly simple. Stand on one leg with your eyes open for 20 seconds. That is it. Patients who couldn't do it had, on average, more silent strokes already present in their brains, more white matter lesions, and a meaningfully higher risk of future cardiovascular events than the patients who could. I'm Dr. Goodman, and on this channel, we explore the published research behind the medical decisions that matter most after age 65. Today, we are going to walk through the simplest 30-second test you can do tomorrow morning in your own bathroom. It gives you a highly meaningful read on your brain's vascular health. We will discuss why it works, what to do if you fail it, and the 4 modifiable factors that can actually improve your test results over time. Throughout the video, I will reference patient cases. Names and details are illustrative composites drawn from common clinical patterns. To understand why balancing on one leg correlates so strongly with your stroke risk, you need to understand a piece of brain biology that rarely gets communicated well in primary care. Your ability to balance on one leg requires the rapid simultaneous integration of 3 different input streams: your visual system, your vestibular system in your inner ear, and your proprioception, your innate sense of where your body is in space. This integration happens in specific areas of the brain that are particularly sensitive to small vessel disease, the gradual narrowing of the tiny arteries that feed your brain tissue. When those small vessels start to fail, often years before you notice any symptoms, the integration of these 3 streams becomes slower, less reliable, and imprecise. Balancing on one leg is essentially a stress test for that integration. A healthy 50-year-old can hold it for 30 seconds with ease, but a patient with developing cerebral small vessel disease, even if they have 0 symptoms yet, typically struggles to get past 15 or 20 seconds. The Tabara study quantified this threshold. The inability to balance on one leg for 20 seconds with eyes open was associated with a roughly 3-fold increased risk of multiple silent infarcts on a brain MRI, even after controlling for age, blood pressure, and other risk factors. That is not a small effect. It is a loud, clear signal that the brain's vascular system is under stress. Let me introduce you to a patient. We'll call her Helen. Helen was 70, a retired librarian who took an aspirin a day and walked daily. Her blood pressure was beautifully controlled at 125/78 on a single low-dose ACE inhibitor. By every conventional medical measure, she was doing exceptionally well. I asked her to try the one-leg test in my office. She made it about 11 seconds before having to put her foot down. She tried again and hit 8 seconds. She was honestly surprised, as she had always considered herself a well-balanced person. Based on that result alone, we ordered a brain MRI. The imaging revealed multiple small vessel ischemic changes in her white matter. It was consistent with chronic hypertensive small vessel disease, even though her blood pressure was technically controlled. The damage was already there. It just hadn't produced outward symptoms yet. We adjusted her treatment plan. We titrated up her ACE inhibitor, added a low-dose statin, and she started a structured balance training program twice a week. 6 months later, she could hold that one-leg balance for 28 seconds. A repeat MRI a year later showed 0 progression of the existing changes. That simple 30-second test is what triggered all of that. Without it, she would have continued under the dangerous assumption that well-controlled was good enough. The test revealed that her brain's small vessels needed much more aggressive protection. Before we walk through the protocol, let me highlight the most common mistake I see when patients try this at home. They do it on a slippery bathroom floor, they hold on to something, or they close their eyes. Each of those fundamentally changes the test. The protocol is very specific. Bare feet or non-slip socks on a stable surface, eyes open, with absolutely no support. Do it next to a wall or counter that you can grab if you start to fall, but do not touch it during the actual test. Have you ever tried this test before, or has a doctor ever asked you to do it? Drop a comment below with how long you can hold it. I am genuinely interested in what baseline numbers look like in normal home environments because the data on this outside of clinical trials is quite sparse. Here is the full 30-second bathroom protocol. It consists of 3 quick tests that together give you a comprehensive read on your brain's vascular function. Test 1. One-leg balance. Stand barefoot or in non-slip socks on a stable floor, near but not touching a wall or counter. Lift one foot just off the ground, about 6 inches up. Keep your eyes open. Look at a fixed point, straight ahead, not down at your foot. Time yourself with a phone stopwatch, or just count 1 Mississippi in your head. A passing score for adults 60 and over is 20 seconds. A strong score is 30 seconds. If you cannot reach 15 seconds without putting your foot down or severely staggering, that is a meaningful signal worth discussing with your doctor. Make sure to switch legs and test both. Asymmetry between your 2 legs can indicate a focal neurological issue rather than general vascular decline. Test 2. The Mirror Smile Test. Look at yourself in the bathroom mirror. Smile broadly, showing your teeth, and hold that smile for 3 seconds. Look closely at the symmetry. Both corners of your mouth should rise equally. If one side droops or rises less, even subtly, that is a possible indicator of facial nerve weakness, an early warning sign of cerebrovascular issues. This is essentially the F in the fast stroke screening acronym, applied as a daily check rather than an emergency response. Test 3. The hand grip test. Grab your toothbrush, a water glass, or any small object firmly with each hand for 10 seconds. Compare the grip strength between your 2 hands. They should feel equal. A noticeable weakness on one side compared to the other is a potential indicator of subtle motor cortex changes. This is the A in the FAST acronym. Together, these 3 tests take less than 30 seconds combined. Done daily, they give you a continuous monitoring system that catches changes far earlier than an annual physical ever will. Now, what should you do if you fail one of these? I want to be very specific here because vague guidance usually leads to either ignoring the result entirely or outright panicking, neither of which is helpful. If you have an isolated bad day, maybe you couldn't balance because of a head cold, fatigue, or an inner ear infection, just repeat the test the next day. An inability to balance from a temporary cause does not equal cerebral small vessel disease. If you consistently fail the one-leg balance, under 15 seconds, across multiple days, schedule a conversation with your primary care physician. Ask specifically about cerebral small vessel disease screening. They may order a brain MRI or refer you to neurology. This is not a medical emergency, but it is highly meaningful clinical information. If you notice a sudden new asymmetry, if one side of your smile droops and it wasn't like that yesterday, or if you experience sudden weakness in one hand, this is potentially an active stroke or transient ischemic attack, TIA. Call emergency services immediately. Time to treatment matters in stroke care more than in almost any other condition. Remember, this 30-second test is a screening tool, not a diagnostic tool. It tells you something is worth investigating. It doesn't tell you exactly what is wrong. Here are the 4 factors that most strongly improve your test results over time, ranked in order of impact for the average patient over 65. Factor 1. Tight blood pressure control. Not just controlled, tightly controlled. Modern guidelines suggest a target under 130/80 for adults at elevated cardiovascular risk. Cerebral small vessel disease is largely a hypertensive disease operating at the microscopic vessel level. Factor 2. Daily walking. A 2018 meta-analysis showed that walking 30 minutes daily reduced incident cerebrovascular events by approximately 20% in adults over 60. This effect is driven partly by blood pressure improvements and partly by direct benefits to your vascular endothelium. Factor 3. Sleep. Getting less than 6 hours of sleep a night is associated with the progression of small vessel disease, completely independent of blood pressure. Sleep is when your glymphatic system clears metabolic waste from your brain tissue. Inadequate sleep means that waste accumulates, contributing to small vessel injury over the years. Factor 4. Specific balance training measurably improves your one-leg balance time within 4 to 6 weeks. This improvement actually reflects neural integration recovery, not just muscle strength. Helen sent me a video last month. She was standing on one leg in her kitchen, brushing her teeth, with zero support, and she held the position for nearly a minute. She is 71 now. Her blood pressure sits at 119/76. Her last cognitive screen was excellent, and she is still walking 3 miles a day. She wrote, "I would have spent the next decade thinking I was doing well if you hadn't asked me to stand on one leg." Funniest thing, that simple test changed everything. That is exactly what this video is about. That 30-second test in your bathroom tomorrow morning is one of the most useful self-screens you can run. It costs absolutely nothing. It requires zero equipment, and it just might tell you something your annual physical is missing. If you've never tried it, try it tomorrow morning. Tell me in the comments what you got. 20 seconds is the threshold. If you clear it easily, you have a solid baseline going forward. If you struggle, that is valuable information worth bringing to your doctor. I'm Dr. Goodman. Take care of each other.